Mobile nanobots for prevention of root canal treatment failure. Root canal treatment is commonly prescribed to treat the infected pulp tissue of human tooth. One of the essential steps of the root canal treatment procedure is sterilizing the root canal space using bactericidal chemicals such as sodium hypochlorite, hydrogen peroxide, and EDTA. More than 10% of endodontic cases are reported to fail. A major cause of failure of root canal treatment is the persistence of bacteria deep within the dentinal tubules, which are difficult to remove through conventional techniques. Dentine is characterized by the presence of hollow, gradually tapering dentinal tubules, traversing across its bulk from inner root canal space toward outer enamel or cementum. Common species of bacteria such as Enterococcus faecalis are lodged inside these microtubular networks of dentinal tubules and naturally protected from the host defense system due to the lack of local blood supply. Figure A. Schematic showing the anatomy of a typical human tooth. The pulp is cleared during the root canal treatment procedure, forming a cavity in the central canal and exposing the dentine tissue. The dotted lines represent the cross-section plane. Figure B. Schematic representation of the cross-section of a human tooth. The central canal is shown in black and a model of a single dentinal tubule is shown. Persistent bacteria at the depth of the tubule are shown as green oval-shaped. Table shown comparison of penetration depth of medicine inside dentinal tubules. First of all, maximum depth of penetration of sodium hypochlorite flushing is less than 20 micrometers, while ultrasound agitation is up to 330 micrometers. Laser penetration in these two showing methods is up to 800 micrometers. Magnetic nanobots reported here as 2000 micrometers. Micro or nanoparticles provide a novel way of targeting disease sites at hard-to-reach places in the human body with cellular-level precision. Various techniques of maneuvering nanobots using chemicals, acoustic, magnetic, and biohybrid actuation method. Magnetically actuated nanobots rely on a rotating magnetic field, usually generated by a triaxial Helmholtz coil to drive a magnetic helical nanostructure. This helical nanostructure is made of silicon dioxide with nearly 15 nanometers of iron embedded into the silica body to provide magnetic properties to the nanobot. The spiral shape of the nanobot provides a chiral structure that helps overcome the limitation placed on swimming in fluid. The manipulation is carried out using small rotation magnetic field that drive the helix along the direction specified by the sense of rotation of the field and the handedness of the helix. Figure A. Schematic showing a triaxial Helmholtz coil similar to the coil setup used for experiments. Figure B. Various snapshots from a movie where the bot was maneuvered forward and backward through a dentinal tubule. Figure C. A longitudinal view of the dentine tissue where the nanobot was driven about 1,000 micrometers inside the depth of the tubule as measured from the entrance at the central canal, using oscillating magnetic field to induce a rocking motion in all the helical nanobots present within the sample, which result in the net movement along the length of the tubules, irrespective of which way the tubules are oriented. Figure A. Schematic showing the distribution of nanobots under an oscillating field. The direction of oscillation is perpendicular to the cross-section plane, as shown by the red cross and dot markers. Figure B. Schematic showing the mechanism of motion of nanobots under the influence of oscillating field near a surface. Figure C. Maximum intensity projection showing the distribution of nanobots under an oscillating field. Figure D. Schematic showing the experimental procedure followed to demonstrate retrieval of nanobots. In step 1, nanobots were subjected to an oscillating magnetic field to drive them randomly inside dentinal tubules. In step 2, a rotating magnetic field was applied along a single direction to empty a sector of the tooth. Figure E. Maximum intensity projection showing the distribution of fluorescent nanobots. The empty space at the lower right corner shows the area which nanobots were retrieved. A combination of rotation and oscillating field may be used to remove nanobots from the dentine, which could be useful to retrieve nanobots after the therapy is delivered. Nanobots can tackle the difficulty of cleaning dentinal tubules. The technique presented here can have broader implication. A wide range of complex canal morphologies exist in the root canal, such as lateral canals, accessory canals, apical deltas, isthmus, C-shaped canals, and various other types of root canal configuration arising from developmental anomalies. A hyperthermia-based bactericidal method, where the magnetic layer embedded in the nanobots, here iron, can be converted to a localized heat source. Heat generated at the surface of the bot was sufficient to eradicate Enterococcus faecalis, which is known to be the primary cause of endodontic reinfection and one of the most resistant bacteria found in the human microbiome. This is a physical method of treating bacterial infection where the possibility of causing antimicrobial resistance is nil. Figure A. Series of images where dead bacteria, stained in red, are near nanobots, which act as localized heat source when subjected to magnetic hyperthermia. Green indicates the live bacteria, which express the green fluorescent protein. Figure B. Maximum intensity projection, showing selectivity in bacterial death inside dentinal tubules. Bacteria were allowed to move inside tubules in all directions. Nanobots were driven along a single direction using a rotating field. Following which the sample was subjected to magnetic hyperthermia, bacteria death is observed along a band in the center where more bacteria were stained red. However, the heat generated by the nanobots is localized to a few micrometers and not sufficient to target a high bacterial load within the tubules, so that we encourage applying multimodal bactericidal strategies, where the nanobots may be only an addition to the physical method. In conclusion, the nanobots are considered as a minimally invasive surgery that provides a maximum penetration depth to the dentinal tubules as a bactericidal effect against Enterococcus faecalis to eliminate the endodontic failure. The antimicrobial activity won't cause a resistance against this mechanism. But just keep in your mind that nanobots are not sufficient to reduce a high bacterial load, so that we consider it as an addition to the primary physical bactericidal strategies.